Hello guys, with you is Mr. Druw. Please, if you are new to my YouTube channel, please hit the subscription button and the notification button to get updated with all my new videos. Let's get started. Thank you.
The humerus bone. The humerus is a typical long bone which developed by cartilaginous ossification. It is the longest bone of the upper limb, which extends from the shoulder joint to the elbow joint, where it is the bone of the arm, where it articulates with the scapula at the glenohumeral joint and with the ulnar and radius at the elbow joint. The view of the humerus bone. You can see the anterior view and the posterior view of the humerus bone. What are the features of the humerus bone? Now, the humerus bone is composed of what? The upper or proximal end, the shaft, your lower or distal end. From the diagram below, you can see the lower or distal end. Now, let's talk about the upper end of the or proximal end of the humerus bone. The upper end or proximal end of the humerus bone is composed of head, two neck, known as your surgical neck and your anatomical neck, two tubercle, which are your greater and lesser tubercle. Now let's talk on this part in details. The humeral head articulates with the glenous cavity of the scapula. The anatomical neck is formed by a groove. From the diagram, the part labeled yellow, it is formed by a groove which separates the head from the greater and lesser tubercle, where it provides attachment site of your glenohumeral joint capsule. Now, from a surgical neck, you see that it is the junction between the upper end and the shaft of the humerus. It is the common site of fracture of the humerus bone. Now, this upper end also have two tubercles, your greater tubercle, which you can see from the diagram, and your lesser tubercle, or you can call it tuberosity. Let's greater tubercle or greater tuberosity, and your lesser tubercle or lesser tuberosity. The greater tubercle is more prominent than the lesser tubercle. It lies on the lateral part of the upper end of the humerus and shows three facets for muscular attachment. These muscles include the supraspinatus muscle, infraspinatus muscle, and your teres minor muscles. While your lesser tubercle is less prominent and it fits anteriorly, it receives the muscle, it provides insertion site forward your subscapularis muscles. In between this tubercle is your intertubercular sulcus, also known as your bicipital groove. This groove lies between the two tuberosity. It has a floor and two lips, your medial and lateral lip. Now, the floor of this intertubercular groove or bicipital groove provides insertion site for your latissimus dorsi muscle. Your lateral lip provides insertion site for your pectoralis major muscles, and the medial lip provides insertion site for your teres major muscles. Now, this intertubercular sulcus or bicipital groove lodges the tendon of the long head of bisect brachial muscles. Now, this intertubercular groove is bridged by the transverse humeral ligament. You can see the transverse humeral ligament, and you can see the long head of the bisect brachial muscles. Now, you can see the transverse humeral ligament is bridging the bicipital groove and is lodging the long head of your bisect brachial muscles. Now, let's go to the shaft of the humerus. The shaft of the humerus, it has three borders, three surfaces. The borders include your anteromedial border. The three borders include your anterior border, your lateral border, and your medial border. has three surfaces: anterolateral surface, anteromedial surface, and posterior surface. Now this shaft has two prominent features: the dental tuberosity and your oblique radial groove. The dental tuberosity is located laterally and it provides what attachment site of our dental muscles. The oblique radial groove, that is the groove for the radial nerve, is found in the posterior aspect of the shaft of the humerus bone. Now what are the contents of this radial groove? Your radial nerve and your profunda brachial artery. You can see the word oblique radial groove. Yes. The lower or distal end of the humerus bone. The lower end of the humerus has the following features: your articular part, which is the trochlear and your capitulum. 2. The epicondyle, your medial and lateral epicondyle, where the medial epicondyle is more prominent than your lateral epicondyle. Before this epicondyle, you have what? Supraepicondyle ridge, medial and lateral part. It has three fossa: your olecranon fossa, your radial fossa, and your coronus fossa. The olecranon fossa is a deep depression on the posterior surface of the lower end above the trochlear. You can see just above the trochlear, you see the olecranon fossa. It lodges the tip of the olecranon fossa or the olecranon process of the ulna when the elbow is fully extended. Upon what full extension of the elbow joint, you see it lodges the tip of what the olecranon process. Now the radial fossa is a small depression above the trochlear on the anterior surface. It receives the end of the radius on full flexion of the elbow. The coronal fossa is a small depression above the trochlear on the anterior surface of the lower end of the humerus bone. It receives the tip of the coronal process of ulna on full flexion of what? The elbow joint. Nerve related to the humerus. We have your axillary nerve, which is found in the surgical neck. Your radial nerve, which is found in the spiral groove. Your ulnar nerve, which is passed posterior to the medial epicondyle, and your medial nerve, which is found in the distal end of what? The humerus.